Hey guys, so for this week's discussion, we were asked to watch the TED Talk, do some research on current trends in pain management, and then create a video and respond to the importance of pain management, describe current trends in pain management, discuss the potential misuse of pain treatments when not correctly monitored or administered. So I watched the TED Talk, What We Lose When We Undertreat Pain by Kate Nicholson. And I did my research, like I said. I really liked this week's topic. I didn't realize, honestly, how many people are suffering, like, especially chronically. It's kind of crazy. It's a huge portion of our population. And I didn't also realize how much being in pain, which you would obviously, it's kind of like common sense. When you're in pain, you don't feel good. But I guess you don't, when you're not in pain and you live normal, you don't really obviously sit there and think about all the people that aren't as fortunate. And so this kind of like made me put myself in other people's shoes and just think about, like, if I, did suffer every day, how that would affect me. And as a mother of multiple children, and especially an autistic daughter, they're highly dependent on me. I just couldn't imagine. So it's very sad, honestly. It really is. And then I hear about like the opioid issue, and like doctors not wanting to prescribe pain medications, basically because so many people are misusing them and how addictive they can be. And so there's kind of like a crisis within that itself of like doctors not even wanting to prescribe certain people who honestly really need it, the proper medications. And so, yeah, like I said, I enjoyed all of this. I didn't even realize too, like, if pain is left untreated and it's not taken care of, it can actually lead to further complications aside from just like general discomfort. It can lead to like loss of function, depression, inability to work, obviously, care for yourself, other people, your children. It's very essential to have pain management because it helps maintain the quality of life, your independence, your mental health, which is very, very important. One of the biggest takeaways that I got from the TED Talk was that undertreating pain is actually just as harmful as overtreating it. And like I said, when you don't really like live in pain every day, you know what I mean? You really do not think of like what that would be like or how much that could really affect you. So yeah, anyway, so from some of my research, pain management today is changing quite a bit compared to the past. For instance, we kind of talked about like that opioid problem, and so like non-opioid methods when possible. I'm a holistic like believer, very anti medications, against pharmaceutical drugs and stuff like that. So like I better be dying if I'm gonna take something. So I am very much so with all of that, But anyway, more focus on physical therapy and rehabilitation, which I think is amazing. And treating mental and emotional side of pain. Creating individualized care plans for each patient because everybody is different. So that's obviously a very, very, important thing also. So basically the main goal is to treat pain in a suffer more balanced way instead of relying on just one method of a treatment, like just medications. Obviously, you want to intertwine all of those things that I just kind of said, make them work together in the best way that you can, and hopefully, misuse of pain medications. Basically, pain management is very important. There are also serious risks with treatments when they're not properly monitored. Like I already said, like the addiction, dependence part of any type of, it's not even just pain medications, you know, there's anxiety medications and other type of medications too that your body can become hyper dependent on. You can, where you can't even like stop taking them because you can have serious withdrawal effects and stuff like that, that can even be harmful, which can lead to like overdose, you know. Misuse happens with medications. Basically, you're overprescribed, you know, if you have a doctor, which I've never in my life came across this as an issue, but I mean, in some states or places, maybe so, where doctors are just overprescribing your medication right and left, sharing medications between people, you know, someone gets prescribed something and they're giving you their meds or whatever. Or if they're not being properly monitored, like I said, you know, dependence and addiction. And sometimes when people are on medications, I think that they can even become forgetful, like, oh, did I take it? You know, take another one, or it gives you an euphoric feeling. Some of them do. You feel good, and that can lead to addiction issues as well. It's important for providers to find a balance between treating the pain and effectively and preventing harm from medications. Pain management is a critical part of healthcare, but it's also very complicated. Like I said, you know, you want to treat the pain, but you don't want to be over treating it or treating it, you know, especially chronic pain. I can't imagine, like, that would be a really hard one, I feel like, because you never know how much someone is really in pain, and people can also pretend to be in pain more than they are, who are seeking. So, you know, anyway, undertreating patients can seriously harm them. Misusing treatments can also be dangerous. The key in finding a balance, proper monitoring, individualized care, using multiple approaches to treat the plan, everything that we pretty much just talked about. Like I said, this topic really made me think about how important it is as a healthcare worker to not just treat the pain, but to treat it like passionately, respectfully, take it into consideration, you know, obviously what your patient, resident, whoever the case may be that you're taking care of, you know, what they're saying to you, take that very seriously. But, you know, you also want to always use your best judgment to follow your gut, make sure that you're doing the due diligence, I think that would be the word, of doing your job properly. Yeah, that's all I got.